Welcome to the Soul of Medicine.
So today we want to bring, I would say, a much more popular topic, or a topic that's gaining a lot of steam and awareness lately. It's on being trauma informed in healthcare. Well, we're going to talk about it and what her relationship to this would be and her experience with it as well. So can I just ask you first, what would you say trauma is?
So the definition of trauma, and this came from Dr. Gabor Mate, who teaches within his container of compassionate inquiry, like a trauma-informed therapeutic model, psychotherapeutic model, which we can talk about. So his definition, and I agree with this, is not the event that happened, but what happens inside of you because of the event.
Awesome. So, for instance, something could have happened to you when you were 3 years old, but it's kind of how you're at some level within your body, you're holding on to it.
So, the way that most people think about trauma is the big T trauma.
Yeah.
War, rape, those violence, those kinds of things, which definitely are traumatizing. However, even the little T traumas, which are, if you think about the little T traumas, as humans, we get into this comparative suffering that if nothing big like that happened to me, therefore I didn't have something traumatizing. It wasn't a trauma to me. So it's even if really the very first trauma as a child is if we're not attuned to by our caretakers or our parents. So for example, if you had a need to be soothed, if you're afraid of thunder, or if you're afraid to be left alone at your friend's house or a relative's house, and that caused anxiety or fear, then that wasn't attuned to, as in you were kind of forced to stay there or had to override the fear, or no, you're fine. They're nice. Come over here and hug them, say hi, when your little body was picking up these vibes of like danger, danger. And the attunement, the proper attunement would be, okay, I see that you're stressed about that. We don't have to go right now, or yeah, I understand that you're feeling that way. Let's talk about it, versus overriding it and telling the child that that's not really how you feel.
So that's fascinating because, you just said like there's big T trauma and there's little T trauma. And the little T trauma would be something that we would easily overlook, something that we thought was kind of innocuous or not a big deal. So how would this is my curiosity, as a child, does that present, like, how does that present in someone as a child? And then how does it present them as an adult?
Well, the thing is, as a child, so the nervous system will do whatever it needs to do to get to safety.
Okay.
So that might mean being overly accommodating, super nice or quiet, or feeling small and invisible. Because if you were big and out there and being seen, you're a target, for some kind of, potential abuse or violation. Right. So our nervous systems and our bodies always want to get us into homeostasis, into balance. So our nervous system will automatically go into a state that makes us feel safer. Does that make sense? So yeah, the hyper pleaser or the hyper functioning person, making sure, checking and rechecking that everything is okay. Because if you made a mistake, then you were, set up maybe to get in trouble or get hurt.
Okay, so you find a way to adapt to such situations. Maybe you're a people pleaser or a hyper pleaser. How would that negatively affect that person?
So, as a child, we don't have choice, right? So I always tell my patients that, as a kid, you did that because you had to survive, and good for you. Here you are talking to me as an adult. So your nervous system did the right thing. As an adult, though, we have to kind of pay attention. Are we really in that survival mode anymore? And how is this being small or being quiet or overly accommodating? How is that functioning in your life right now? And how it presents usually is fatigue, anxiety, even ADD and ADHD, which, by the way, is an adaptation from a childhood that had been traumatic.
Fascinating. And instead, we just medicate them.
We just medicate them.
Yeah.
So if a hyper-vigilant brain and always thinking about the next thing and all the things, is your brain adapted that way, your nervous system adapted that way to ensure that your environment was safe and you were safe, or your siblings were safe, or your parents were safe, or one parent was safe.
I'm hearing this word adaptation. What are other ways? So I'm hearing these are ways that we can do through our actions, how we can adapt to make ourselves feel safe, make others around us or what we feel is doing. But what are other adaptive techniques that people might bring on, good or bad?
Yeah, as an adult.
As an adult, yeah. How would this parlay? Are there other ways that they can adapt to feel safe, or even as a child?
Well, first, I think it's the acknowledgement of what had happened. And this is not to say our parents and our caregivers didn't love us. That's not what I'm talking about, right? It's just the child was not seen, heard, and matter. That's what they felt. I wasn't seen, heard, and matter, or I didn't matter at the moment. And so asking, what did you need then? Or I needed a hug, or I needed somebody to tell me that it was going to be okay, et cetera. Because as an adult, we're really playing out that part of us that was a little child, the wounded child.
Yeah.
And honestly, most of the time, there's just that really, if we look at it, we're all wounded children playing on a playground, which looks like an office or a clinic or a pharmacy or a hospital or corporate America. Think about it like that. So if you have those unhealed wounds, that's going to play out as an adult. And first of it's knowing, is my anxiety, where's my anxiety coming from? Did this just start now? I doubt it. It probably started, long ago. So my questioning for a patient would be, where do you feel this in your body? How old is that memory? How long have you been feeling this way?
For the audience, so Kay and I work together in a practice. It's a functional medicine practice. And this is what I want to ask you. So when people come to see you, what are some of the reasons why externally? What are you hearing? And then when you sit down with them with such questions, when do you recognize that there is maybe an element of trauma?
So, I get the things that primary care gets, like fatigue or hormone imbalance, weight gain, anxiety, depression, high blood pressure, diabetes, all these kinds of things. Those are some are diagnoses, some are somatic symptoms, but all of it stems from childhood trauma. That's a bold statement to say.
Yeah, that's big.
Honestly, people would be like, yeah, right. But inquire. It is my belief. So then my line of inquiry goes back to that initial wound as a child, right? And this is the compassionate inquiry process. So it is my assumption that there was a trauma. If my definition, given that my definition is something happened and not the event, but what happened inside of them and the emotion that happened inside of them, right? So then so we're in fight, flight, and freeze mode. And when there's a trauma that it gets lodged we freeze. So it doesn't go anywhere because one, it's not acknowledged as a trauma. And then I ask, who did you tell as a child? It's usually no one. Why? Because I didn't want to get in trouble, because nobody would understand. Oh, I didn't want to be a burden. And that right there encompasses how then they live their lives.
I was just going to say, yeah.
There's life before being an adult. Come on. It's, and if you're not going back into the history and inquiring what happened back then, which informs the way one grows up and informs the way that they look at the world, informs the way that they make their choices.
Well, and that's got to affect every relationship they have, every relationship they get into, every job that they take, how they perform in their job, choices they make and don't make, every path along the way. Right. Not just their health.
Right. But think about it. So if your nervous system is wired so that I need to protect myself from the big and scary, from the angry people. You're going to make choices out of that lens.
Okay, fascinating. So with functional medicine, we use the term a lot, root cause, right? So now I'm starting to hear, so people might come in for root cause and we talk about balance. We talk about balance in adrenals, stress, hormones, gut health, right? Dialing it in. But it seems sometimes that the drivers for these imbalances often still go unaddressed, even in realms of functional medicine.
Correct. So if we're looking from a very physical level, I usually assume that everything was really driven by adrenals.
Yeah.
And the reason why I say that is because early in the history, I look at them and I know that they're stressed. Come on, like most people are stressed. The stress impacts us through the HPA axis. And then, I keep digging a little bit more in there. So, and you can kind of see it if you know that the adrenals drive the thyroid and the sex hormones as well as the gut through the vagus nerve, being in sympathetic mode versus parasympathetic. I mean, that kind of makes sense as the root cause, right? Mm-hmm. The adrenals are, and they will tell me, yes, I've been stressed, or I've had this stress for a sustained period of time, and I'm just coming out of it. Usually they're in freeze mode at that point, so they don't feel anxiety, but that doesn't mean the nervous system hasn't been activated or isn't still activated. So I'm assuming there's somewhere along that HPA axis, whether it's hyper, sort of in the middle, wired tired, or freeze mode, which is hypoadrenalism. So then you have to ask, what is the stress? Why is it chronic? How long is this going on? Usually it's, well, I just got divorced, or I just moved, or I just retired, or COVID, or, I've had serial deaths in the family, and I, something like that, which usually presents for an extended period of time in adulthood. But then that adult learned how to adapt in that way from somewhere. And that the key question is, how long have you been feeling this way? How long has this anxiety been in your chest? How long has this feeling in your guts been there? And it's usually like a long time. How long? How old were you? 3. Okay, what happened? And then they go into some story that's really significant. And that's kind of what we call the genesis of identity. There was an incident that happened where the child had to survive that moment and get to safety, whether it's physical, emotional, whatever. But that is then lodged in the tissues, that way of being, their story, if you will, their belief. I'm alone and I'm not safe. I'm alone and whatever.
Yeah. So now in their life, what are they going to do with that story?
So they're just going to prove the story,
Yeah. So taking actions, life choices that literally prove the story they've been telling themselves.
Right. So they prove the story that they're really not alone. So what do? They're a member of every club. They're like social butterflies. They are people pleasers. They never say no, because they never want to be alone, because that would mean that they're unloved. So when you really dissect that, that's what a child would think. I'm not saying it's wrong, but it's a very primal thought process for a child. And to undo that is to really, now we're adults, but now we have choice, because back then we didn't have choice. So that's kind of the first thing where a lot of compassion has to take place. I mean, you couldn't leave and drive somewhere, get a job. I mean, you're only like 3, right? Like, so come on. I mean, let's be real. But as an adult, we're stuck in that loop of I'm alone and I'm not loved, so I'm just going to do anything, forgo my own preferences and my needs to prove that story untrue, that I am not alone and I am loved.
All external. Yeah.
And then these habits and personality traits that we've developed was born out of the story. So if you realize that, okay, you were a kid, that story isn't true. Are you really alone? No.
Right.
Are you really loved? Yes. So that's where the mind shift and the healing happens, is that to prove that story was what we call a lie. I mean, that's what you made up when you were 6. So you can change that narrative so that all the things that you do now, which is serve people, help people, are selfless, doesn't come from a place of filling a hole. You come from that place just because you want to. I just want to help people because.
Yeah. Gotcha.
And then, where that comes physically is like you expend all your energy, have zero boundaries, and you're doing everything for everyone except yourself. And that patient presents as chronic fatigue, fibromyalgia, stomach pains, or even chronic metabolic issues. I mean, that's where it all stems from. So when somebody says that they can't measure stress or stress doesn't matter, like, I don't really understand that. I mean, it completely turns into a physiologic state. So to say that we're only addressing the physical body is only part of it. But if you really want to get to the root, you have to get into the emotionality of it. I mean, that's really where the root is, and that is trauma. So, I mean, when we're doing physical medicine, I'm talking about functional medicine, conventional medicine, those kinds of things, they may help alleviate, tension, when you balance the hormones, when your gut isn't leaky and, you're reducing inflammation. Of course, that's helpful, but that just takes the edge off. It's important, and nutrition and diet is important. And that goes along with this deeper work, because I will say that doing this deeper work and inquiring and doing trauma work is very taxing on a body. Yeah. It's almost like doing like a big liver cleanse or a GI cleanse, or removing your amalgams, or, explanting. We want the guts to be in good working order to be able to handle the detox of those toxins. Same thing with emotions. Right. So I wouldn't want to necessarily throw my patient first off in intensive trauma therapy if they're not sleeping, or if they are fatigued, to really crash and burn them.
Yeah. My assumption here, if it's done inappropriately at the wrong time and wrong amounts, trauma therapy could probably lead to trauma.
Oh, you definitely can get traumatized from that. And so the way I would love to approach it is doing some of the physical modalities first, but addressing the relationship between emotions, trauma, and their physicality. Mm-hmm. That's kind of like, that must happen. Yeah. Now, I'm not saying the first session you go into, massive trauma, because they're not even expecting that anyway. And some of them come in and say, I've had a history of trauma, but they're not connecting how it's affecting their physicality. Yeah. Right. So just connecting the dots initially would be a good thing. Working then on the physical and strengthening this tissues, because they have battle wounds for decades. Yeah. Right. Running, and from the tiger. And then I kind of like it to the peeling of the onion. So they get that first layer, then the second layer, and then suddenly they're ready to really do that deeper work. And they'll come to you and start inquiring, who do I need to go to? I want to talk about this. Say, for instance, I were to go to a therapist. I was just giggling because a patient said, if I were to go, who would you recommend for me? I'm not saying that I'm going.
A friend was asking me if they would go to, right?
I'm like, okay, yeah, here's a few people.
So it's preparing. And that's what we say, it's kind of like when people, like, healing is a journey, right? And you want to be prepared for that journey. So part of that is being physiologically strong, because there is something between our physiology as well as our mind and our emotions. And there is that link, and it's that strengthening for that. When you speak to patients, and if they, like, say they're coming in, they're like, I just need my hormones fixed. I'm coming to get my hormones fixed, right? And then you have this conversation, and then, like, does a light bulb go off in their head? Do they sometimes reject the notion that something at 3 years old could affect where they are today?
Yes.
And then what do you do?
So there's an art to really navigating that. So first, if they say, I know my hormones are off, I'm like, okay, yeah, they're off. When a woman says her hormones are off, they're off. Yeah. And we have lots of hormones, so it's not just sex hormones. And so inquiring like, when did this happen? How did this happen? Where did your hormones go if you're not menopausal yet? And explaining to them that whole triad of the adrenals, the sex hormones, and the thyroid, how they all communicate together. You just start inquiring, how's your gut? How's your thyroid? And histories. So histories of painful periods or heavy bleeding. It's like, well, it looks like, there's some imbalance there to begin with a long time ago. So I try to thread their history together. Right. And then I'm always asking, what happened then? What happened at that time? Nothing. Okay, well, did you move? Or their relationship? I mean, most people have buried it, so it's not an issue that's on their forebrain that they can think of that was the trauma, but again, recapping. So it's what happened to you. And most of the people that come to see me are very empathic. They're very sensitive, and explain to them that that's what happens. You absorb a lot of people's energy. And this is, your nature to take on like a sponge, the negativity of the world, which then translates to, putting you on that adrenal HPA axis pathway for a really long time. And most of them are nodding at that. So the relationship is not talking about it. I'm actually talking about it from my own experience. So I get it. And that kind of relatability with your patient I think is really important, because if you're talking down to them, like, and not relating, like, yeah, I get you, then that's going to be really hard. So, a big thing about talking about trauma is also, knowing that you also may have had it in your life, probably. I mean, most people do, if not all, and holding that space of compassion for, the patient, the client, noticing too what happens in your body when this comes up,
Well, it's really interesting. And if you can imagine, so, Kay and I, we will speak professionally, we will speak personally. And, Kay has run me down these inquiries, I guess you could say. And when their questions are coming at you, like, and what happened then? And, how do you feel? Sometimes one can be a little frustrating, because like I have difficulty sometimes tapping into what exactly that was. Right. So from a patient's point of view, it's almost like you're being challenged maybe in that moment. It almost, or even an inquisition to that point. So it really is, I think, a way to properly hold space and assess their feelings so they feel comfortable and relaxed, so they can still dive down to those points.
I think, the part of compassionate inquiry, or even somatic experiencing, which we can talk about those two types of trauma therapy, is that it brings them back to the body. Soma means body. So where do you feel that in your body? That's how you link it. What do you mean? I feel nothing. I'm like, okay, so any tightness in your chest, any pressure anywhere, do you have does your throat feel tight? They're disembodied, so they're not aware of what's actually happening. So it's one of two things. They're actually there's no sensation there, which is possible. But the other is that they're so numb that they don't even know. If something shot them, they would not even feel it, because they've gotten so numb to that. But when people start to, so I would say, assume that they were in freeze mode, which is fight, flight, freeze. This is pretty much stage 3 HPA axis dysfunction. And it's, how do you unfreeze somebody? Right. And they have to feel safe to do that. They're in freeze mode. Think about freeze mode. What's the possum or the gazelle that's running from the tiger? I mean, they're in freeze mode, right? And they have to shake it. So what they do to get back into society is that they have to, when they feel safe, they shake it off. But we don't, as humans, don't have the opportunity to shake it off. And if you watch any somatic therapies or body work happen, and you're really addressing the traumas that have stuck in the tissues, there's a shaking, like I said, even like a convulsion that happens to get that out of the body. It's very interesting.
I mean, I saw something on myofascial release the other day where they were working and someone literally went through that.
So think about the fascia, which is the covering of the muscle. So the most simplistic way is like, if you have a chicken breast and that white sort of layer, the fascia. So the fascia is like kind of the hot topic right now in research. And that is where the subconscious, it's in that layer.
So the experiences of trauma
they get lodged in the fascial layer. So when you do myofascial release or craniosacral therapy or anything with, addressing fascia, then you start to release that. So, the things that make the fascia really tight are dehydration, stress, and non-movement, immobility. So we talk a lot about moving those tissues. That's why things like Pilates or yoga or, some kind of stretching or myofascial releasing therapies, even, massage, self-massage, or using the yoga tune-up balls, moving that will help you mobilize that stuff out of your body.
So, let's talk about it too, because when you talk about myofascial release, you think about you're going for something that resembles a massage or something like that. It's kind of hands-on, but there's actually oftentimes an emotional reaction that comes from it.
Right, because they're not just massaging muscles. They're actually working on fascial adhesions, fascial layers. Every time I get some kind of body work like that, I don't realize how much I hold in those tissues, which we do.
Yeah.
Right. And that's not really taught in conventional medicine, pharmacy. I mean, they barely relate the body to, how everything is related. So, but this is beyond physical things, and if you really do think about it for yourself, and start integrating the emotions and the body and the psyche and the spirit, I mean, this is where true healing starts to happen. But if we start segmenting it, if I just, treat my physical body, everything's going to be okay. Yeah, that doesn't happen. I mean, I've rarely seen that just be the one thing.
And I want to talk about different approaches to therapy, which myofascial release would be one. But before we do that, just this adaption thing keeps swirling in my head. And, one tenet or principle I look at with Beyond the Labs is like, nothing's black and white, right? There's always this in between. It's like pharmacon. Anything can be your medicine. Anything can be your poison. It's just one's relationship to it. So when I see this, you see people that have gone through trauma and they may become habitual with certain things. Maybe it's prescription medications. Maybe it's alcohol. Maybe it's overworking out or something like that. So can you speak to that? Because I don't really think there is a black or white in sense, like this is bad for you, like alcohol completely bad. Like there's benefits possibly of relaxing the day through a glass of wine.
So the way that I would look at it, and that the deeper issue that you're talking is probably addictions. So in whatever form that is. So looking at the addiction, not the substance, but what the substance does for you, how it's functional for you.
Okay.
Right. So the alcohol is functional. So I just had a patient the other day, she called herself an addict. She went through rehab and just kind of beat herself up around it. But the inquiry was, how was that functional for you? What did it allow you to do? And she's like, it allowed me to have fun. I'm like, okay. So the thing that you really wanted was the fun, right? So there was no good or bad. It was just the alcohol helped her downregulate her nervous system, so she wasn't always in her head and she could relax and then connect with people and have fun.
That's fascinating.
Versus like, oh my God, I can't believe you do that. And the alcohol's so bad. And like,
shame,
there is no healing in shame. Like take the shame piece out of it. Right. And you're like, yeah. So then you could say, okay, yeah, you could use the alcohol for that, but you say that you don't feel well afterwards. So are there other ways to get the fun? Are there, you know what I mean? So same thing with like sugar or caffeine. What does the sugar or caffeine? Well, it gives me a high. It makes me feel happy. It gives me energy. Okay, sure, great. So what's wrong with wanting to have energy and feel vibrant? Usually they're like, but the sugar I crash and, or I gain weight with that. It's like, okay, well, if you're really going for the energy and the vitality, are there other ways to get there?
Yeah, it makes a lot of sense. Yeah. What could be what's something that could be more generative for you? That's going to give you the result that you're looking for.
But there's no shame. It's like, okay, I get it why you did,
Yeah. But that's got to be part of the healing, because if you're denying that and shaming it out, that's part of you that will never be healed either if you're not given the awareness to that.
It's like, I understand the choice, why you made that choice.
Yeah.
I mean, or the wine people, it's like, I love wine. I'm like, I'm sure you do. Like, I do too. And how's it functioning for you?
Right.
Yeah, it just downregulates my nervous system because my work is so stressful and blah, blah, blah. And, it's like, but I get so tired in the morning. Or it's like, okay, so sounds like you want more peace.
Is there other generative ways that you can go about that?
Yeah.
All right. So we've got practitioners to listen, probably mostly pharmacists. They spot this in whether they're in a consultative practice or across the counter, right? I always like to train them and teach them to put a Rolodex together, right? Find other practitioners, similar mindset, different disciplines that they can call upon. They may not be this expert trauma therapist, which they're not going to be, right? So what are some recommendations? Like we heard myofascial release, like if they found a practitioner locally that they can refer to people to, that would be one direction. What other tools can they put in their toolbox?
I mean, you could recommend trauma-informed therapists. Okay, here's the thing though around that. Regular therapy, I feel, does not work because trauma is in the body, right? It happened in the body, not the mind. And when you're doing a lot of talk therapy, you're kind of disassociating away from the body. So the patient client needs to feel, to be able to process this. And thinking about it, talking about it, living neck up is what actually happened at the moment the trauma happened. You disassociated into your brain, into your mind, as a way of protecting you. That was the nervous system protection away from the body, because if you felt it, it would be painful, right? So the idea is, talking about therapy in a cognitive sense it won't work. You'll be in that kind of therapy forever. And most people do not get better. They're just going around in circles or getting re-traumatized. It's in my experience with my clients. So there's two forms of therapy that I would prefer that they go to that deal more with the body, which is somatic experiencing. And we can post that website. You could just look up the practitioners or give the patient. You can look it up yourself in your area and see who practices that and maybe give them a call or have a session with them so you can figure out, what kind of work they do. They'll be so impressed if you did call them because they love that clinicians can connect that. And that's a 3-year-long training. So there's a lot of therapists that go on to do this work. So they have the therapy background, but they also have this somatic experiencing, we call them SEP, in their bag. And then compassionate inquiry practitioners is who I use myself. It's the same thing, getting you back into the body. Their line of inquiry is very compassionate. I have found it a very efficient way of processing trauma in a very safe way. We can also post, there are practitioners all over the world. Both of these bodies of trauma therapists do online as well. They could be, some could be local. The ones that I've used are not even in this country. They're fabulous as international. And then body work, myofascial release. You can find those therapists. We've even, physical therapists, I think, are starting to do that now. Now, these are for, I think I like sending them to myofascial release therapy when there's like physical tension that they're holding on to. It may be a nice way so they're not talking about it. There's that initial layer of releasing emotions,
Two birds in one stone.
Yeah, and it not being too intense. So a lot of my patients prefer that first and then go into the deeper kind of therapy. I love myofascial release because I don't have to talk or talking all the time. And it's just really nice. That's how I say it to my patients. You don't have to talk about it. You just have to feel it. They're like, okay, sign me up. So you can look that up in your area.
It's funny. And to speak to that, you were talking about like the CI, compassion inquiry practitioners. I've used one as well overseas. And what was interesting, for years, I was being told by Kay and others that, no, certain things in your life, that's a trauma. So, for me, it was very interesting because I couldn't see it, nor could I feel it. And I think that goes with a lot of people. And I think a lot of people, even in the realms of conventional medicine, that are stepping into functional medicine and the beyond approach, they don't really realize that, one, this stuff exists within you, possibly, and two, that there's actually quite efficient and different ways to approach it. Which to me was like, okay, so I would sit down and be like, there's nothing wrong with me. But then it's like you dive into it, it's like, oh shit, like look what was uncovered. So it's fascinating.
And that minimization, that minimizing is also a very much an adaptive behavior.
Oh.
So, I think part of the inquiry is recognizing when there is a deflection, when there is a minimizing, you have to kind of tread lightly about, pushing somebody to go in there right away around it. But, you can start with different kinds of modalities that are less invasive, if you will, like the body work, to start chipping away at it. The other thing that I wanted to mention was about this relationship with childhood and chronic disease. So there is a questionnaire, this is a study, a huge landmark study of ACE scores, the adverse childhood events. But anyway, we have that actually on our questionnaire. So if you score, I believe, 4 and above or 8 and above, based on the types of events that would happen in childhood, it could actually predict your chance of chronic illness as an adult. This is huge. These are conventional studies. These are not functional medicine studies, but this is very big in the pediatric world right now. And, inquiring with children already, the pediatric group of have these things happen, have they had exposure to this, because that more likely to have chronic illness in the future. So you could, if those of you who are doing coaching and you have an intake form, I would include the ACE questionnaire in there so they can fill it out and you can see what their maybe tendency is.
What a great tool. That's awesome.
Mm-hmm.
That's excellent. What I didn't ask, so you're going through your practice, you've had your path of years being a physician, and what was it that kind of turned your head to say, wait, there's this trauma thing that needs to be addressed? Like, when was it in your career?
When a coach of mine actually said that was trauma in your life. Now that I look back, I'm like, I'm one big ball of adaptation. And so the learning from that is like, if I didn't have to adapt and work so hard to create safety in my life, or like, who would I be? Like, if I didn't have to spend my entire life pleasing other people, saving other people, perfecting things, and, making sure I don't screw up something, it's a lot of energy expenditure, right? If I didn't have to do that and I felt safe in my own skin and who I was and just existing without having to do extra work on top of it, how would I be? Who would I be? I'm like, damn, I think I would be a completely different human being, in fact, right? After being disappointed multiple times around that, you kind of create this barrier. So the way that I create safety as an adult now is, my boundaries are everywhere with my schedule, the types of people that I see. I hired on my assistant is like a bulldog. She's like wonderful, like June Cleaver, but she'll bite your head off, and I not because I'm a weak person. And for a long time, I was like, you should be able to handle that on your own. But that barrier helps me. It keeps it's I don't want to answer every single question, every single email on the minutia. Do you know what I mean? And so I want to preserve my energy for my patients and those kinds of clinical questions, right? And then I have another layer of help that sort of is that barrier for just sort of the not unimportant, but the more mundane things, right? So my energy isn't as depleted. So you have to kind of think about that, when you put your teams together and who takes care of what, and you can't really do everything, and choosing how long, how much, who, what kind, I think, and how much time you need off and how many patients is too much. And, what kinds of focuses clinically do you want to do? If some, like, I don't want to see men in my practice, not because I don't like men, but I'm not a guy. So, and that's why you took that on, which is a big help because you could really go deep with them. I sound like a naggy mom or something when I'm talking to guys. Are like, why are you eating that? Like, why are you treating your wife that way? No, just kidding. But it's just really understanding where your pocket is. And, and we were talking about, integrative cancer care, bringing that in and, working with somebody, a physician who actually went through it, and so there's self-awareness where you don't need to spread yourself too thin.
And I think from a practice point of view, I mean, it just allows professional growth and also personal, because you still get to be within yourself and your own vibe and your own lane.
Right.
Okay. So it's been said, where you trip up in life, therein lies the treasure. Is there a gift in trauma? So we're healthcare practitioners, right? And it's about when people recognize a trauma, is there learning? Is there a lesson? Is there a gift that comes from that for them?
Well, always. I think that's that archetypal wounded healer, right? Who was Chiron, I know you talk about that quite a bit, but it's the wound that is actually the initiation.
Yeah.
Right. Because the wound for me had become something I had to study and learn and heal to be able to teach it to other people, to be able to, I would rather go to a healer practitioner who gets it, who understands, or maybe has gone through the same thing because they know it from a different level, not just reading it in a book or taking a course.
Yep.
You know what I mean?
Yep.
And so the wound becomes the gift.
Yes.
The wound becomes the gift. So we can stay in the wound and just be victimized by it. You can, that's a choice. However, did the wound happen so that you could heal it and then offer it is usually always kind of the way that I think about it. If you're a doctor, a clinician, whatever, we're not beyond trauma. We're not beyond, wounds. We're not beyond failure, right?
Yep.
We're real. We're humans too. And that kind of humanity, I feel, needs to be brought in. And once you start tapping into your own humanity, giving that a lot of compassion, then you'll be able to give that to other people.
And I think what's incredibly fascinating about that, when we talk about that, so like the wound is the gift. So someone comes in for a particular hormonal balance, lack of energy, difficulty sleeping, whatever it might be. But then if they actually can come to this awareness that there is this wound, and then they get through it, and then they come out the other side, not even just balanced from their health issues that they were primarily complaining about, but almost like another individual with like a next step on the path to take. So there's just even more potential that's discovered along the path.
Yeah. So that's the forward movement. And then there's that backward healing of the wound, which happened again, as we said, back in childhood. And I kind of ask my patients, like, imagine you as that little boy or little girl sitting right beside you. Not have been attuned to what does that little boy or little girl need. And it could mean just a hug. It could mean just tell me I'm going to be okay, or that I did the right thing. And that's kind of the rewiring of your nervous system of like, you are okay. You're going to be fine. You only, as the adult, you can only do that. There's no supplement. There's no other therapist. There's no other person, even the parent, that didn't attune, they can't tell you that. And that's the way you heal. You have to reparent yourself, right? And heal that wound so that you could go on to that adult that you were meant to. There's always parts of us, that are operating. There's the childhood part, the adult part, the teenager part, there's parts of us. And this is a psychological, the internal family systems and parts therapy that, there's different parts of us that are always talking all the time, and fighting or going together. And that causes that chaos inside and that adrenal run, if you will. Hamster wheel. So, like, this is such an internal, sort of intangible, invisible way of looking at it. But this is why meditation and yoga and reflective practices work, because we're actually using that time to think about this stuff. And if you're running 100 miles per hour, there's no way you're going to get to it, right? So you can start to see, we don't just do yoga to do yoga. We don't just sit and write in a book for nothing. These are active healing practices, because you're always getting to the root of that onion to the deep core wound. And once you start realizing that, that's when that you are safe, you are great, you are loved, you're not alone, you're, surrounded by people that really do love you. I mean, and you're safe, then go do the thing you're supposed to do. It's the antithesis of that keeps us small and tired and, sad and like all the things. And you wonder why we can't reach your potential.
Yep.
It's not that you can, it's just we have these things in the way. It's like, just have to clear them out.
Reach your potential, find your joy.
Mm-hmm. Mm-hmm.
Awesome. I really appreciate this. Is there any last thoughts that you have we might not have touched upon? Because this was, I think, phenomenal, especially for, most of mainstream medicine and even functional medicine. This isn't touched upon. And as we said, it is part of the root cause, right? Any final thoughts from yourself?
I just think that, just having the awareness of it and the sensitivity around it and what we call trauma-informed primary care.
Mm-hmm.
I mean, the mere fact that you actually can make those connections or help the patient make those connections in some way, I think is really amazing. You're light years ahead of most practitioners. But to ignore that or assume it doesn't exist, I think does a disservice to the patient and to yourself.
And we see the healing in the patients.
Mm-hmm.
Yeah. Awesome.
Because really, right, all they needed was acknowledgement.
Thank you so much for the time here. Enjoyed it as always. And we will talk to y'all later. Thanks for tuning in. Thank you for listening to this episode of the Soul of Medicine podcast, where science meets soul for whole health healing. Are you ready to reclaim your energy, vitality, and soul purpose? Then feel free to head to our website at kcorpusmd.com and schedule an appointment for your root cause review.